9 medications linked to memory loss. Somewhere in this country, right now, a family is sitting in a doctor's office hearing the word dementia for the first time. It happens roughly once every minute. And here's the part almost nobody tells them. For a portion of these families, age was never the real cause. The real cause was sitting quietly in a bottle on the bathroom shelf, something they'd been told, over and over, was completely safe. I'm Dr. William. 15 years into practice, and I've lost count of how many times I've watched the same story unfold. A patient who was mentally sharp their entire life suddenly can't hold on to names, misses appointments, gets lost driving a route they've done 1,000 times. Family calls it just getting older. Most of the time it isn't. It's a prescription nobody thought to question, because a doctor wrote it and a pharmacist filled it, so it must be fine, right? New research says otherwise. There's a category of everyday, completely ordinary medications that can measurably damage memory and learning in as little as 12 months, and the people taking them almost never connect the dots. Today, I'm ranking the 9 drugs most strongly linked to accelerated memory decline, starting with the ones that fly under the radar and ending with the one I consider the most dangerous of them all. Keep an eye on number 3 especially. It's given to millions of seniors for something that sounds completely trivial, and it may be quietly damaging the parts of your brain responsible for memory, with 0 warning signs. Before we start, drop your age in the comments, along with any daily medications you're on. I actually read these, and they shape what topics I cover in future videos. Let's get into it. Number 9. Number 9 on the list is diphenhydramine. Don't let its spot at the bottom fool you. This one is probably in your house right now. It's the go-to pink pill for sleep, allergies, or a cold. No prescription needed, a couple dollars a box, sitting right there on an open shelf. That accessibility makes people assume it's harmless. Inside the brain, the story is very different. Benadryl is an anticholinergic, a drug that blocks acetylcholine, the chemical messenger your brain relies on to form new memories and stay mentally alert. Your brain naturally produces less of this as you age, which means it's already running on a thinner margin. Block even more of it, and an aging brain absorbs the hit far harder than a younger one would. The structure that takes the worst of it is the hippocampus, the small, seahorse-shaped region where new memories get created before being filed away long-term. I've had patients take a nightly antihistamine for years and slowly lose their sharpness, never once suspecting the little pink pill by their bed. A 2023 study in the Journal of Geriatric Cognitive Health tracked older adults on regular anticholinergic use and found a 54% higher risk of developing dementia compared with non-users. Over half. From something most people treat like candy. What to actually do? Check the label on anything you take for sleep, especially products marked PM, nighttime, or allergy relief. Most of those are just Benadryl in disguise. If allergies are the issue, newer antihistamines like loratadine, Claritin, don't cross into the brain the same way and are much safer long-term. Never stop anything on your own, but stop assuming over-the-counter automatically means safe for your memory. Number 8. Your stomach loves this one. Your brain quietly foots the bill. Sold as Pralosec and Nexium, PPIs shut down stomach acid production and are handed out constantly for heartburn and reflux. People often stay on them for years, sometimes decades, because stopping brings the burning right back, which makes the drug feel irreplaceable. Here's what almost nobody explains at the pharmacy. Stomach acid is what lets your body absorb key nutrients, vitamin B12 in particular, which protects your nerve and brain wiring. Suppress acid production long enough, and B12 quietly drops. Magnesium and calcium follow, both essential for your neurons to fire correctly. Starve the brain of those, and you get confusion and memory lapses that look almost identical to early Alzheimer's, except the actual cause is a nutrient deficiency your own medication created. A 2016 study in JAMA Neurology, covering over 73,000 adults aged 75 plus, found Regular PPI users carried a 44% higher dementia risk. It gets worse. PPIs have also been linked to elevated amyloid beta levels, the same sticky protein associated with Alzheimer's. The move, if you're on a daily PPI, talk to your doctor about tapering toward H2 blockers like famotidine, Pepcid, which carry far less cognitive risk. Deglycyrrhizinated licorice, DGL, can also soothe the stomach lining naturally. The goal is the lowest dose for the shortest time, not a lifelong habit. Number 7. Number 7 treats something most people don't love discussing. Oxybutynin, ditropan, is prescribed for overactive bladder, the sudden, urgent need to find a bathroom that can dictate an entire day. The relief it provides is real, and so is the embarrassment it spares people. But oxybutynin blocks acetylcholine, the exact same memory chemical Benadryl interferes with, and it crosses into the brain unusually easily, settling right where memories are formed. That makes it one of the riskier drugs on this entire list for long-term use. A 2019 British Medical Journal study followed adults over 65 on strong anticholinergics like oxybutynin for a year or more, and found their dementia risk climbed 49%, nearly 1.5 times normal. What troubles me most, almost none of them were warned. They were told it would calm their bladder. Nobody mentioned it might be dimming their mind at the same time. Missed keys, forgotten conversations, blanked appointments. Everyone chalks it up to age, and the prescription rarely gets a second look until real cognitive ground is already lost. If this is you, you don't have to trade your bladder for your brain. Mirabegron, Myrbetriq, works through a completely different pathway, doesn't touch acetylcholine, and offers comparable relief for most older adults with far less cognitive risk. Bring it up at your next appointment. Number 6. This one might surprise you. Statins are among the most prescribed drugs on the planet, especially past age 60. And to be clear up front, this isn't an argument against statins. They lower cholesterol and reduce heart attack and stroke risk in a very real, very important way. But there's a half of the story that rarely gets mentioned. Your brain is nearly 60% fat, and it depends on cholesterol to build myelin, the insulating layer around nerve fibers that lets signals travel quickly and cleanly. Push cholesterol down aggressively enough, and you can leave the brain short of raw material it genuinely needs. The statins most likely to cause trouble are the ones that cross easily into brain tissue. A 2023 study in Frontiers in Aging Neuroscience found adults over 70 on statins for 3+ years had a 26% higher rate of mild cognitive impairment, and the effect scaled with dosage. Patients describe unsettling gaps, a familiar name vanishing, a conversation forgotten minutes after it happened, a 20-year commute suddenly unrecognizable. Not every statin behaves the same way, though. Pravastatin and rosuvastatin don't cross into brain tissue as readily and are generally considered gentler choices cognitively. If you're on a statin and noticing fog or forgetfulness, that's worth a conversation with your doctor about dose or switching, not a reason to quietly stop something protecting your heart. Get professional guidance, always. Quick favor. If this is connecting some dots for you, tap that like button. It genuinely helps this reach more people who need it. And tell me in the comments, how many prescriptions are you currently taking? I read everyone. Number 5. Ativan, Valium, Xanax, some of the most commonly prescribed anxiety and sleep medications in the country. They work by amplifying GABA, your brain's natural calming signal. At first, they can feel like a genuine rescue. Panic eases, racing thoughts slow, sleep finally arrives. Over time, that picture shifts. A 2022 British Medical Journal study tracked over 8,000 seniors for 6 years and found those using benzodiazepines longer than 3 months had a 51% higher risk of developing Alzheimer's. Longer-acting versions like diazepam are especially concerning because they linger in the body and accumulate in brain tissue. These drugs essentially sedate the brain chemically over time. Learning slows. Mental flexibility drops. Many people describe a persistent emotional flatness, like moving through fog and not quite feeling like themselves. The cruelest part is the exit. Stopping abruptly can bring anxiety and insomnia roaring back even harder, with dangerous agitation, which is exactly what makes the drug feel indispensable at the moment. It may be doing the most damage. Critical rule: if you've taken a benzodiazepine for more than a few weeks, never stop suddenly. It can be genuinely dangerous. Taper slowly with your doctor's guidance over weeks or months. Buspirone can ease anxiety without the sedation or fog. Specialized insomnia-focused talk therapy, CBTI, can also restore sleep without the cognitive trade-off. Number 4. One medication, prescribed for 3 completely different problems, and one of the heaviest hidden burdens on this entire list. Amitriptyline is an older antidepressant still widely used today for nerve pain, sleep issues, and migraine prevention. That versatility is exactly why it stayed so common. It looks like a drug that does everything. Underneath that, though, it's one of the most powerfully anticholinergic drugs still in regular use, blocking acetylcholine aggressively enough that with long-term use, memory decline stops being a rare side effect and starts looking like an expected one. A 2015 JAMA internal medicine study, following over 3,400 adults 65 plus, found those with the highest cumulative anticholinergic exposure, amitriptyline included, over a decade had a 54% greater dementia risk. Almost none of them were told this was possible. They were prescribed it for sleep or pain, then slowly noticed words disappearing and concentration thinning, assuming it was simply age. It doesn't take a high dose either. A small nightly amount over years can erode cognition quietly, with no obvious red flags, until the loss is substantial. Alternatives worth discussing: duloxetine or gabapentin for nerve pain, melatonin or low-dose doxepin for sleep, and newer antidepressants like escitalopram for mood, all considerably gentler on this chemical pathway. Number 3. This is the one I flagged at the start, because it's prescribed to millions for something that sounds entirely harmless. Paroxetine belongs to the SSRI family, used for depression and anxiety, and on the surface looks like a modern, gentle option compared to older psychiatric drugs. Here's what rarely gets discussed. Paroxetine is the one SSRI with genuine anticholinergic activity, setting it apart from relatives like sertraline and escitalopram, and putting it on the same chemical collision course as everything else on this list. A 2021 review in Frontiers in Psychiatry looked at older adults across different SSRIs and found paroxetine users showed measurable drops in short-term memory, word recall, and attention within their first year of use, 30% more likely to show early cognitive impairment than users of other antidepressants. There's a bitter irony there. A drug meant to stabilize the mind may, over time, chip away at the very clarity it was supposed to protect. Paroxetine actually appears on the American Geriatric Society's Beers list, a formal list of medications considered potentially inappropriate for older adults, specifically for this reason. If you're on it, ask your doctor about switching to sertraline or escitalopram, which don't carry the same cognitive baggage. Supporting B12 and B6 levels may also help mood, alongside any changes. Number 2. This one concerns me more than almost anything else on this list, because most people taking it don't even realize what class of drug it belongs to. Seroquel, Risperdal, and Zyprexa were developed for serious conditions like schizophrenia and bipolar disorder. Today, though, they're frequently prescribed off-label to seniors for sleep issues, restlessness, or dementia-related agitation. Powerful psychiatric medication used, often, simply because a patient is hard for an overworked care team to manage. A 2022 study in Lancet Healthy Longevity, following over 25,000 older adults, found those given antipsychotics for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even without any prior dementia diagnosis. These drugs also raise stroke risk, sudden cardiac risk, and fall risk through heavy sedation. They work by suppressing dopamine, which governs not just mood, but focus and memory too. Suppress it enough and people can appear emotionally flat or nearly absent, while family quietly grieves someone who's still physically there. If this applies to you or a loved one, ask the prescriber directly. Why was this started, and is it still necessary, or is it convenience? Often, behavioral symptoms improve through routine, reduced overstimulation, treating hidden pain, and better sleep hygiene, without medication at all. Number 1. Here's the twist. Number 1 isn't a single drug. It might be the biggest hidden factor behind every story in this video. You were probably expecting one final villain. The real danger is subtler. It's the slow buildup of multiple anticholinergic medications taken together, with nobody ever adding up the combined effect. Picture this. A senior takes Benadryl nightly for sleep, oxybutynin daily for bladder control, and amitriptyline for nerve pain. Individually, each drug's effect might be barely noticeable. Combined, the cumulative load on the brain climbs fast. A 2022 study in Age and Aging tracked over 280,000 older adults and found those with the highest combined anticholinergic burden had a 120% higher dementia risk within 10 years, more than double. The vast majority had no idea they were even taking anticholinergic drugs because nobody had ever explained the concept to them. Here's the hopeful part, and the reason I made this video. Medication-driven cognitive decline is often reversible when caught early. Reduce the burden, and many people regain clarity and memory within weeks or months. It just requires a proper medication review. Sitting down with your doctor or pharmacist and going through every prescription, over-the-counter product and supplement, adding up the total anticholinergic load, and adjusting under medical supervision. This may be the single most preventable threat to the aging brain on this entire list, which is exactly why it takes the top spot. Of these 9, which ones are sitting in your medicine cabinet right now? Have you noticed fog or forgetfulness after starting something new? Tell me in the comments, and tell me you'll ask for a medication review this week. Your comment might be exactly what helps the next person reading it. One more thing before you go. Your medicine cabinet isn't the only place your body hides warning signs. Your fingernails can flag kidney, blood, and even nervous system issues years before other symptoms show up, and almost nobody knows what to look for. That's next video. 4 nail signs worth checking tonight. I'm Dr. William. Stay sharp, and I'll see you there.